স্যার
কিছু
জয়েন
join
করে
করেছে।
গেছেন।
তাহলে শুরু করা যায় এখন?
হ্যাঁ,
start করি?
লাইভ হয়েছে?
তাহলে শুরু করছি।
ঠিক আছে, হ্যাঁ শুরু।
I would like to welcome all of our esteemed delegates and respected audience to the second session of our vibrant webinar, Yoga, a Holistic Approach to Physiological and Psychological Homeostasis. As per yogic scriptures, the practice of yoga leads to the union of individual consciousness, that is Jivatma, with that of the universal consciousness, that is Paramatma, indicating a perfect harmony between the mind and body, man and nature. Thus, all the paths leads to supreme consciousness and infinite peace are called yoga. Thakur Sri Ramakrishna Paramahansa said in Bengali, "Joto mot toto path," which means as many faith, so many paths. All these paths of yoga may be broadly classified into four: Bhakti Yoga, path of non-attachment or selfless love; Karma Yoga, path of non-attachment work, that is, work without expectation; Jnana Yoga, path of pure knowledge, that is, knowledge without ego; and Raja Yoga, path of concentration. All these paths are elaborately described by Swami Vivekananda in his series of lectures. Although yoga mainly deals with mind, but there is a very well-known verse in Vedic philosophy, Sharira Madhyam Khalu Dharma Sadhana, that is, body is the primary medium for spiritual practice. And here comes Hatha Yoga Pradipika, written by Yogi Swatmarama in between 6th to 15th century. The purpose of Hatha Yoga is to relieve from three types of pains: physical, environmental, and spiritual. And through the practice given in the Hatha Yoga Pradipika, we are able to prepare the body for Raja Yoga. Hatha Yoga Pradipika deals with asana, shat karma, 6 key pranayama practices, mudras and bandhas, and samadhi. Thus, through yoga, one can increase physical, intellectual, and spiritual strength to achieve a state of everlasting peace. Swami Ranganathanandaji, 13th President Maharaj of Ramakrishna Order, one of the greatest ambassador of Vedanta to the West after Swami Vivekananda, said in his lecture, "The Upanishads investigated the body-mind complex of man and found it to consist of various layers, beginning with the gross muscular layer at the external end and subtle and subtler layer internal. The first such subtle dimension being the nervous system, and the next the psychic system. In the word of Sri Krishna in Gita, uh, Indriyani paranyahur indriyabhya param manah manasastu para buddhir ya buddhih parat paratastusa. The sense organs are superior to the sense objects. They say, superior to the senses is the mind, and superior to the mind is the buddhi or reason. What is even to the buddhi is he, the Atman. So, mind, reasoning, and self are the more and more subtle part of the body. Great physiologist Charles Sherrington once said, "Mind, meaning by the thoughts, memory, feeling, reasoning, and so on, is difficult to bring into a class of physical thing." Great neurosurgeon and inventor of cortical homunculus, Dr. Wilder Penfield, said, "Thus, the highest brain mechanism provide the mind with its energy and energy in such a changed form that it no longer needs to be conducted along neuraxon. This idea of Dr. Penfield can be found in Chandogya Upanishad. Annam asitam tridha vidhiyate tassa ya stabista dhatu tat purisam bhavati ya madhyama tat mamsam ya amishtha tat manaha. The food is eaten becomes divided threefold. The grossest part become waste product, the middle part become flesh and other part of body including brain and nervous system, and the subtlest part become mind. From our basic concept of thermodynamics, it is understood easily that the major part of energy is entropy and released as excretory product. Other part is free energy, which may be interconvertible between potential and kinetic energy and responsible for formation of macromolecules and the flow of bioenergy. Thus, more subtle form of energy is not at all impossible, as thought by Dr. Penfield. Thus, yogic science is still relevant and may show light to lots of dark areas of modern science. Namaskaram.
Thank you, Prashanjit sir, for the beautiful introduction, and welcome back to the second session of the two-day international webinar. This session will be chaired by Dr. Krishnendu Pradhan, Vice President, Physical Education Foundation of India, West Bengal Chapter, and Associate Professor, Gorbeta College, West Bengal, and Dr. Nimai Chand Mashanto, Officer in Charge, Government General Degree College, Mohanpur, Paschim Mednipur, West Bengal. The eminent delegates for this session are Professor Pratiti Ghosh, Dr. Ekta Khandelwal, and Dr. Kuntal Ghosh. I would again announce for the participants that any queries may be posted in the chat box in the YouTube link, and they will be answered at the end of each lecture. Thank you. I request our respected chairpersons to kindly initiate the session.
Okay, very good afternoon, everybody. It's my pleasure to introduce Dr. Pratiti Ghosh. Dr. Pratiti Ghosh is presently the professor and head of the Department of Physiology, West Bengal State University. She had graduated in physiology from Presidency College and postgraduated from University of Calcutta. After her PhD from the same university, she gathered postdoctoral research experience at USUHS and served as visiting fellow at the National Institute of Health, USA. She has received a few fellowships and awards and has numerous peer-reviewed publications, book chapters, and textbooks to her credit. She is presently researching on different aspects of lifestyle and stress physiology, ranging from yogasans to P-glycoprotein mediated multi-drug resistance. I am really proud of her. We are fellow student of the same university. So over to Professor Ghosh, please.
Thank you, Dr. Ramasanta. I have successfully shared my screen, right? And I'm audible
Yes, ma'am.
also, right?
Yes, you're
ma'am.
audible.
Okay, thank you so much. So I'll be talking about homeostasis through yoga. We all know, and we have heard a little bit in this earlier session also, that a healthy mental life is a mandate for good physiological health. What is required from this is sharp mental acuteness, strength of life force, and wisdom, which all help in effectively daily dealings and communication, not only a question of just physiological health. That's what I imply. So, what are ways to achieve this? We'll be listening a little bit about which type of yoga is being concerned here, arenas beyond our reach of assessment, what are the gross benefits and the relevance of prana and kosha in physiology, how do the medications work, pranayam and meditation on brain anatomy and function, yoga and immunity, thus spirituality and physiology. We have just gone through the different paths of yoga. The name yoga or the yog, it considers the different ways that union with God or the supreme power can be achieved, which is through bhakti yoga, karma yoga, jnana yoga, raj yoga. But we as physiologists, as at this moment, is concerned with hatha yoga, which is making a strong determined effort to achieve well-being of the body and mind with emphasis on practicing of asanas and pranayamas. We are also considering under this heading the Patanjali's Yoga Sutras, the eight limbs of yoga, which consists of the ways of the lifestyle, the ways one should be uh, living their life, practicing non-violence, truthfulness, non-stealing, abiding in the awareness of divine consciousness, not accumulating things unnecessarily, keeping oneself clean, content, happy, practicing self discipline, study of the self and abiding by it, and then ultimately honoring and surrendering to the divine. These eight aspects also encompass the yoga poses, the pranayamas, that is the breathing techniques, pratyahara or taking oneself, one taking the awareness inwards, and dharana and dhyana, which automatically follows if all these things are followed. So, with special reference to asanas and dhyanas, the rest of the talk shall be continued. So the impact of yogic practice, as we have seen here, following this eightfold path, is not within the purview of technology, except for the asanas, that too ideally under extremely severe, stringent conditions, which actually cannot be subserved on any group, because we, for any experiment, we need first a control group who has never done it, and then an experimental group who has done it perfectly. So an experimental group who will do it will not do it perfectly, because they will not be able to follow these eightfold paths, usually they don't. And or the persons or the swamijis or whoever have been following these paths before they entered that path, and after today, like 4 years after they are in this path, it's very difficult to obtain such subjects. So it is difficult to have such dedicated practitioners who melt into the process and stringently uh, uh, take about every pose with the breath, and obtaining their previous data is also a very hard task. Anyway, what is the yoga that we are dealing with? It's the union of mind, body, and soul. There are different types of yoga. If we open the internet, there are really tons of types of yoga. So here we'll be referring to only the traditional form of yoga, which have been observed to have no deleterious consequences since the last hundreds of years. The variously distorted forms of yoga, especially in the competitive spirit in kids, have been observed to hamper growth in the formative years. There are yogas like in the picture of Vinyasa Yoga, Kundalini Yoga, Hatha Yoga, Ashtanga Yoga, Yin Yoga, Iyengar Yoga according to one's name, Vikram Yoga according to another's name, Vipassana Yoga, Restorative Yoga, Prenatal Yoga, Aerial Yoga, Acro Yoga, Anusara Yoga, Jiva Mukti Yoga. They have all taken the yoga mat and considered different poses with twists according to their according to whatever their plan is there. But we are not really concerned with, for example, hot yoga, which is done at temperatures around more than 40 degrees centigrade, which is really not a very hygienic thing inside the room to do. But anyway, they have their other benefits, just as there is the benefits of spa and sauna bath. But we shall not consider them under the heading of yoga today, at least. Then there are the different types of gymnastics, dances, punched with yoga and given the name yoga. But actually, that's also not the thing which we are looking for. Then there is a form of Surya Namaskar is a series of 12 exercises done all at a stretch one by one, and depending on the speed of its action, it can serve as a perfect aerobic exercise or as a if it is done slowly, it may be considered to be proper yoga with the breaths, etc. It's a perfect obesity controller also. The general known types of yoga, whatever we see, whatever we have, the different asanas, all of them affect the entire body as a whole, as well as definitely some specific organs inside the body. The other type is Sukshma Asana, that is where you really do not move around your body much, but you focus on the breath. You focus, the one focuses on one's own self, on the mind, on the concentrating totally on the mind, on the breath, or a particular part of the body, like the Agya Chakra between the eyebrows, things like that, which is supposed to have a great effect on your mental health. So there are some measurable benefits of yoga which helps maintain the, we know that it helps maintain the cardiovascular health, stimulates the neural and endocrine system, helps in stretching, flexing and toning the muscles, improving the range of movement of joints, improve digestion, circulation and immunity, strengthens the immune system, improves posture and body alignment, enhances cognitive functions, improves overall health, strengthening the body, relaxes the mind, imparting energy, thus creating an ideal homeostasis. The rest are beyond description and can only be experienced. So, what is this homeostasis here? It's the auto reset function of the body. Yoga accelerates this reboot of the body by a holistic approach, which is very much like the Ayurveda and the homeopathy, which considers the entire body as a whole instead of focusing on some specific organs or some specific points. It is this organismic aspect, that is the Annamaya Kosha, which is being dealt with, uh, encompassing the Manomaya Kosha, that is the sheath beyond us, beyond this body, in contrast to allopathy, where only the reductionist approach takes place. What is this organismic holistic approach? That is when we are considering the effects of something on the entire body. Here we can see the musculoskeletal system, the circulatory system, the nervous system. All these systems, as physiologists, we know that we are all interacting with each other every single moment to give about the final verdict regarding the health of an individual. It cannot, one system cannot be considered as separate from the other according to this view. So the prana dealing with the respiratory system, apana with the excretory system, vyana with the circulatory system, samana with the gastrointestinal system, ultimately determine how long and how effectively the soul will live inside the body till it is in the state of going away from it, that is the urana. The nervous system has two aspects. We know that there's a central nervous system and the autonomic nervous system, which innervate every single organ of our body, thus trying to have a total connection. There is a total, that is, all the organs are singly connected and singly organized by all, the automated function is done by the nervous system. This may be considered from a reductionist approach at the molecular and the submolecular level, where every single nerve, every single type of muscle cell, every single type of sperm or oocyte, irrespective of their size or shape, they are being considered to see what effect yoga has on these specific cells and on the submolecules. There is the other aspect. That is, if we consider, not if we consider, the Vedantic science considers that the human body has Annamaya Kosha, that is the food sheet, the earth element, which we are, in which we can see, perceive ourselves. The other is the vital sheet or the water element with Pranamaya Kosha, the mental sheet, fire element with the Manomaya Kosha, the Vijnanmaya Kosha consisting of the intellect, the intuitive with the air element, which everybody is really not endowed with, the Anandamaya Kosha or the bliss sheet with the ether or the space element, that which is experienced after dhyan. So psychosomatic expression is an expression of all these koshas together, along with, and we in sthula sharira, that is in our physical body, are affected by this in this body or causal body. So allopathic medicines basically act in this annamaya kosha, that is in the sthula sharira, in our physical body, making it superficial, as it rarely acts on the root the major cause of the disease that are generated or settled in other koshas, which are often dealt with by aromatherapy or with homeopathic medicines or with diet plans, which probably affect the other koshas in the Vigyanmay koshas and the Manomay koshas. The specialty of the yoga package, by package I mean all the Eightfold Path, it primarily affects the brain or the Sahasrara and the nervous system, which thus distributes bliss to all the organs, thus maximizing homeostasis. The different parts of the brain get stimulated in particular manner during meditation and pranayama. This is the effect of scientific studies where it has been seen that the frontal lobe, which plans, reasons, and switches off during meditation, it helps in detachment and relaxation. The thalamus, which relays motor and sensory signals to the cerebral cortex, and the reticular brain, which is responsible for alertness and helps respond to situations, both of them slow down their activity, enabling calmness in the mind. The parietal lobe, which gives a sense of time, also slows down, helps to lower stress and anxiety level. We might think that these are if this is the case, that they will help, they will impede our growth, they will impede our competitiveness, they will hamper our desire to reach the goal or to be first in anything. But actually that's not the case, because the entire brain is supposed to be in the perfect state, which can give the perfect verdict with the minimum time, and thus effectively it enhances all the work that we are trying to achieve. These are the different EEG waves that what they do: the alpha waves, the beta waves, the theta waves, and the delta waves, which are involved in the which are always occurring in the brain, and they are altered to a good degree by pranayama and meditation. We know that in the waking state, this is the state, and in the state of non-REM sleep, this is the state, which is very much akin to the transcendental meditation. That is, there is increased EEG coherence that we observed during transcendental meditation, akin to the sleep phase, but it is not a sleep phase. So there is increase in the frequencies expressed in the alpha range, increased alpha band power, and an overall reduction in frequency in EEG activity. The alpha blocking phenomenon, which is a state change in the brain function, is also a possible trait change, which is observed in long time meditators. There are some differences in the case of long time meditators and meditators for a short while, but yet whatever, during meditation the change in EEG occurs in all kind of meditators. The EEG oscillation contrasts between focused attention and open monitoring meditation practices. So we see here that the frontotemporal alpha waves, the frontotemporal beta waves, the theta waves, and the parieto-occipital alpha waves and the parieto-occipital gamma waves, they do change when when the open monitoring meditation practices are monitored by different modes, not only by EEG, also with MRI. The analysis of 21 neuroimaging studies has shown that, especially with functional MRI, 8 brain regions were found to be consistently altered, including areas key to meta awareness, that is, the frontopolar cortex, Brodmann's area 10, exteroceptive and interoceptive body awareness, sensory cortex, and insular cortex. The hippocampus, with concerned with memory consolidation and reconsolidation, self and emotion regulation, which is done by the anterior cingulate cortex, orbitofrontal cortex, the intra and interhemispheric communication, which is done by the superior longitudinal fasciculus and corpus callosum. These changes were distinguished by increased densities in gray matter regions and white matter pathways. A great number of structural changes were also found in the left hemisphere. These changes have been found to be consistent, I repeat, with the long time meditators. They also experienced a slower age-related decline for cerebral gray matter volume in the putamen, which plays a role in learning, cognitive flexibility, and attention processing. This could suggest that a better attentiveness in aging meditators than the non-meditators. There is also higher tolerance for pain and temperature, as evident from the altered structure function in the somatosensory cortices and increased ability to decouple regions in the brain associated with the cognitive appraisal of brain in the anterior cingulate cortex and dorsolateral prefrontal cortex. So the brain state changes are almost exclusively found in the higher order of executive and association cortices, supporting that meditation increases self-regulation and attentiveness, which further increase concentration and ability to carry out a work with less mistakes. These changes alter the functionality and connectivity of the default mode network, which is a hypothesized network of brain regions that are active when an individual is engaged in internal tasks such as daydreaming. That is, it alters the disease pathways, making it more closer to the original non-diseased form of the pathways. Just as a drop of, it acts like a drop of amrit. Even if a small amount of yoga is done every single day, it acts like a drop of amrit, and that cannot easily be monitored. It's difficult to monitor except over the course of years. But if the effect of a drop of poison can very easily be known. Considering the circulatory system, here is the arteriovenous circulatory system. This is the only the arterial system and is the only venous system. They are responsible for channelizing nutrients and energy to the entire body, which may be vaguely akin to the invisible 72,000 nadis or channels in the body in the Vedantic system as known as a whole. The source and extension of the prana channels probably extend beyond the gross body to the subtle and causal forms, which might explain the unidentified power behind meager intake of food, sparse sleep, yet indomitable energy in the yogis or the spiritual practitioners. These nadis through which the prana moves have been partly identified by acupuncture needles tipped with radiophosphorus. Three of them are important, that is Pingla, Ida, and Susumna, that is the parasympathetic nervous system, sympathetic nervous system, and the spinal cord. Because Kundalini energy passes through this nadi only, and which ultimately connects every single organ of our body, as we have seen earlier. They emanate from the spinal cord, but they never cross over as they innervate all the organs. This is what we have seen in case of our sympathetic and parasympathetic nervous system also, where sympathetic, the Pingla system deals with like the sympathetic nervous system, and the Ida deals with like the parasympathetic nervous system, the Chandra Nadi and the Surya Nadi, as they are called with in the conventional terms. What about the cardiac diseases and yoga? So the risk factors, the yoga that is done, it is, if now at this moment we may consider it to be akin to exercise, and of course it pranayama should also be included because it lowers down all our blood pressure factors. So it decreases the unhealthy serum lipid markers, the baroreflex sensitivity, the renin-angiotensin response, the sympathoadrenal activity, all which are essential in lowering the blood pressure in essential hypertensives. The age-related deterioration in cardiovascular functions, in coronary lesions and myocardial perfusions improve with yogic lifestyle. What about the skeletal muscle strength? Yes, just as we are using the dumbbells, without using the dumbbells also the skeletal muscle strength can also be obtained by repeated practice of the yoga. There are some yogic techniques which involve isometric contraction, which improve the dexterity, strength, and thus neuromuscular skeletal coordination, improving orthostatic tolerance and gait with upright posture and balance, thus strengthening the bones and preventing age-related weakening. What about the respiratory system, which is involved with the pranayama, which is activated with the pranayama also? So the respiratory centers are the stimuli to the respiratory centers are consciously changed, thus controlling respiration. It is said that if the pattern of respiration can be changed, one can control the mind. So it effectively exerts control over the mind and the thoughts. This is what has been said since thousands of years. So pranayama, practice of pranayama has been observed to lower exertion-induced supranormal level of blood lactate, which causes exhaustion and pain in the athletes, which has been scientifically observed. Now let's see the last part. That is the immune system. We know that the immune system consists of uh, the lymph, some allergic reactions, some autoimmune problems, some overactiveness as occurs during cancer or during infection. Some immune underreaction is desirable. So does it have any role in our present COVID immunity? Yes, it does. Uh, there are different kinds of poses which are there in yoga, and some of them where they open up the chest and throat, they stimulate the thymus. The inversion poses stimulate the flow of lymph and immune cells. The twisters and hip openers stimulate the spleen and lymph node, and the bends stimulate the natural defenses, all ultimately relaxing the nervous system. So the effectivity of these cells have been observed to enhance with yogic practice, especially with Sudarshan Kriya, as has been tested are mm, and have been published in peer-reviewed journals. So Nayantara, regular practice of yoga imparts great benefits in the from the psychosomatic aspect. That is, it increases peace of mind, which affects the limbic system, improves clarity of the cerebrum, that is the seat of higher thinking. Thus, stress can be effectively dealt with. It increases concentration of the mind, improves self-esteem, decreases reliance on drugs, and imparts greater energy and enthusiasm for life. So there is the spiritual realm which can be attained through yoga, and we are really not dealing with that, but it's just a part of yoga, so we are just talking about it a little bit. It's a saying that yat pripinde tat brahmande, that whatever is there in us, it is there in the universe, or whatever is there in the universe is within us. So uncaptured by realms of physiology technologically doesn't imply non-existence, as only the invisible tools can assess the invisible. So what is this invisible? Ultraviolet rays or infrared rays, ultra audible or infraudible sounds, imperceptible vibrations. They are all ultra and infra with respect to the humans, but probably they have a great range of perceptibility in animals, fish, different insects, and plants. Just because we do not understand them, we do not feel them, we do not know them, does not necessarily imply that it is non existence. Similarly, the entire yogasana practices with its eightfold paths cannot be assessed by the scientific assessments. So it definitely has an impact on the humans, but there is not really such a measurable yardstick which can assess all the parameters. Thanks for implementing it in your daily routine. Thank you.
Thank you, ma'am.
Thank you, Dr. Pratiti Ghosh, for your very illustrious uh, matter, and we are really enriched from your vibrant lecture. And so far, my knowledge, you are the you did your PhD on biochemistry, but nowadays you are switch over to yoga. Very good, very good. We are really enriched. Now, Dr. Ghosh, we have some questions for yourself. Please go through that question, and I would request Dakhani ma'am, please.
Yes, sir. Thank you, sir. Ma'am, the first question we have is to explain the pain mechanism where yoga can influence to reduce the musculoskeletal pain.
Okay, so it is not the your entire thing that is being reduced. It is only the effectiveness of pain that is being reduced. It's the sensation of pain that is being reduced.
Okay,
It is
ma'am.
the sensation of pain that is being reduced in the somatosensory cortices. Is my screen still being shared? No.
No, ma'am.
Okay, okay. It's only the effectiveness of pain that is being reduced. It's the sensation which is being reduced
Thank you, ma'am.
in the brain.
Ma'am,
Not that the nerve endings have died out or anything like that. It's just the sensation has been reduced in the brain. Next.
Ma'am, the next question is, in concept of Pachokosha, psychosomatic diseases are start from which seat? Is it from Annamay or Andamay or Anandamay to Annamay?
It is said in psychology itself that diseases do not initiate in the body except for accidents, which is done by someone else. Otherwise, diseases normally initiate in other layers which are beyond our physical body, and then finally they come over to the physical body. That is said not only in the Vedantic realm but also in psychology.
Thank you, ma'am. Ma'am, that's all.
Okay. Uh, Warm greetings to Pratiti for suitable lecture on this pandemic. So we should have to practice yoga day to day. And after this lecture, after this webinar, 2 days webinar, I request all the audience to practice yoga so that we can free from pandemic. Now,
Thank you, Dr. Masanta.
okay, thank you. Our next speaker, eminent speaker, Dr. Ekta Khandelwal. So I feel proud to introduce her. Dr. Khandelwal is presently Associate Professor in the Department of Physiology, AIMS Raipur. She had completed her MBBS from Pandit JNM Medical College, Raipur, and MD, SRC in Physiology from AIMS, New Delhi. She has been engaged in the research activity for about 13 years, working in the field of clinical physiology, that means investigations, autonomic nervous system in health and disease, exploring physiological intervention of various diseases. She has numerous awards and grants from ICMR, CGCOST, and several other prestigious bodies to her credit, and has publications in national and international peer-reviewed journals. Dr. Khandelwal will be discussing on cardiovascular autonomic response in yoga practice. May I request Dr. Khandelwal? Over to Dr. Khandelwal, please.
Am I audible, sir?
Yes, you are audible and visible both.
Very good afternoon, sir. First of all, I want to thank the organizing committee for giving this wonderful platform to share experience. It is really very nice to be the part of such kind of scientific activity in this COVID-19 situation. And I'm really very happy to share very briefly about my experience. And after ma'am's talk, who has actually covered almost all the homostatic mechanism of yoga, my job has become quite easy. So, myself, Dr. Ekta Khandelwal, Associate Professor Physiology, AIMS Raipur. Cardiovascular autonomic response in yoga practices. It is a question every physiologist has in their mind. Like now, yoga is not any kind of fancy word. Now it becomes the need of life. The one thing which I want to emphasize is that initially the people who are very much health conscious or very disciplined lifestyle are practicing yoga on a regular basis. But as time goes on and as we in this pandemic situation, now each and everybody, from child to in fact adult, okay, are now in a phase where they can realize the importance of yoga practice. Being physiologist, one question always come in my mind that it is absolutely correct that yoga change your lifestyle. Yoga balances all your functions of the body. Yoga does calmness, it increases your concentration, it makes you happy, it reduces pain, and many others wonders. But how? The question arises how? How much? What is the mechanism? Why it is doing so? what is the thing it is actually changing in someone's or one's body. So, with this brief introduction, let me take you where I am starting my talk. As we all know that already discussed earlier also, yoga is a very age-old practice and it is founded in India. The word means yoga means unity, which is from Sanskrit, the classical language of India. But I want to say it also means discipline or effort. The question arises, yoga as a branch of contemporary medicine now becomes generic. Why? Why we want yoga to be the part of medical curriculum, medical system, and now Ayush is putting so much effort to bring yoga as a holistic approach. The answer is, first of all, there is an increase in awareness in everybody for health, and people are now want to adapt an alternate way of medicine to what more for preventive cause. As we all know that prevention is better than cure, and yoga is a wonderful way of prevention of any kind of disease, which is being said. Yoga is a holistic health science. We are now all agreed with it. It is the best lifestyle designed ever in ages. Time tested. We have known yoga, people doing yogic practices, and we have the best example I'm going to do quoted over here will be Dalai Lama. And being physician, as myself is a physician, my friends are physicians who are actually practicing yoga, are better guide, are stress-free, calm, and more stamina. Sorry, is my presentation on?
Yes, ma'am, your presentation is on. However, your video is getting stopped at
Is
some time, and voice is
okay,
breaking.
because it is uh, 1 minute.
Yes, ma'am.
Just a second, because it has present now. Voice is breaking. The shiny. Is it now audible?
It is now audible, and video is also
Yeah.
not breaking. Yes, ma'am.
Okay, fine. Thank you, Dr. Dakshini.
Thank
It
you,
is
ma'am.
just a network issue because we have lots of wind in our area, so network is very poor. I'm really very sorry for that.
No, ma'am,
So
that's okay.
the
Ma'am,
question is that,
if you're comfortable, you may
yeah,
switch off your video if you are comfortable with that. Then there will be a little
yeah, yeah.
less problem in the network connection.
Okay, Dr. Dakshini, I'll do the same.
Ma'am, you can put your presentation, but stop your video. Your
Video.
presentation
Yeah,
has
I
gone. Yes, sure.
sure, I'll do that. The presentation is now visible, Dr. Dakshini?
No, ma'am, it is not visible.
Presentation is not visible now.
No, ma'am.
Okay, just,
Please present now again.
yeah, sure. Just a second. Is it visible now?
No, ma'am. Yes, it is. It is. It is coming now. Yes, ma'am. It is visible now.
Coming?
Right.
Yes,
Okay.
ma'am.
Yeah. So I'm here in relevance of yoga.
Yes,
Right?
ma'am.
So
Yes.
thank you, and I'm really very sorry. The
No,
No,
thing
no.
is, okay, as Madam has also discussed that what yoga do, it basically balances your spirit, mind, and body, and it is the best way to bring homeostasis in your body. My talk will be mainly in what it does to the body, what happens in the physiology is, as we all know, we are all physiologists. It is a vast and very vast thing to cover. I'm generally going to cover the main thing, what is actually happening in the body in respect to cardiovascular system and respiratory system. So, physiological effect of the yoga practice is basically divided into two parts. One is immediate effect, the effect which you can see immediately, that is known as acute effect. Lots of research is going on this acute mechanism. Second is your long term effect, which is a training effect. which actually improves your physiological functions. This both immediate and long-term effect can be quantified. As I'm going to share our own research work, which is going on, and the data with you, that how it can be quantified. This effect both is basically depend upon duration, for how long we are doing the yoga, what is the intensity of the yoga, it is not like that you have to bend forward, backward, sideward, and it is going to produce changes in your body. No, it is not. Yoga is a very much disciplined science. You have to actually do yogic practice in a very disciplined manner. And what kind of practices you are doing, not all kind of a yogic exercise are prescribed for everybody. It has direct effect on your cardiovascular system. So the people having a hypertension are being said you are not supposed to do Bhastrika Pranayama, or forward bending is not good for them. We are going to discuss this in a brief in my upcoming slides. So, physiological effect of training, as Madam has mentioned, all things like metabolism, musculoskeletal, neurophysiological, my talk will basically revolve around autonomic balance, cardiovascular system, and respiratory system. For before starting this, first we have to understand how the organization of neural control occurs and where this yogic exercise put our change their put their effect or change our system. If we see, we have a center for information which integrate all the information. It can be present in the brain, in the part of a brain, or in medulla, spinal cord, anywhere. It is a center for which we have an afferent. Afferent carries sensory information about the status of cardiovascular system, about pressure, volume, or any part of the body, any kind of a system. And after modulating in this center, we got efferent response, which carries the effector signal to the heart of blood system. And this efferent leads to changes in efferent response. This is the simplest arc which we understand. And this arc is generally managed by autonomic nervous system. But we have further things into it. We have a very high control of modulation, that is higher centers in this center. So it is not that autonomic nervous system is totally autonomous. It has to be under the control of central system. So when we meditate, prefrontal cortex has become very active and it controls our autonomic nervous system. Apart from it, efferent signals about the physiological state of the body. If body is not in a good condition, or it is not only the body, if the mind is also in not a good condition, it is going to stimulate your higher centers directly, which leads to modulation of this center. And also there is a feed forward signals which also modulate your higher center. So this is in the simplest physiological arc. These centers are being modulated by yoga, and how we are going to discuss in coming slides. This is a simple division of autonomic nervous system. As we know, autonomic nervous system is a part of peripheral nervous system, and there should be a critical balance between parasympathetic and sympathetic response. Parasympathetic division, we all love, say it is a rest and digest. Parasympathetic activity dominates. It will give you calmness, coolness, reduces your blood pressure, reduces your heart rate, but not beyond a physiological limit. It should be balanced. It's the same with the sympathetic, which is known as flight or flight response. It is the system which is basically responsible for life to carry on. And it involves ease, exercise, excitement, emergency, embarrassment, described by Walter Cannon. So there should be a critical balance between this parasympathetic and sympathetic nervous system, which is a two limb of autonomic nervous system, which is known as vagosympatho balance. This vagal sympathetic balance is responsible for maintaining your normal cardiac function. And any kind of stress, disease, drug effect leads to alteration in this response, in this balancedness. So what does it do, and what we actually going to get from this, we are going to discuss. Few known paper literature has said that this autonomic control is modulated by Nadi Shuddhi Pranayama, which stimulates parasympathetic. If you are feeling anxious, if you are feeling a little bit of anxiety, stress, you should do Nadi Shuddhi. And Kapalbhati stimulates sympathetic, That is why we used to say Kapalbhati is not very good. The people who are having a high hypertension or people who are having a labile blood pressure, because it can shoot to diastolic shoots tremendously. Apart from it, if we see that breathing through the left or right nostril is also said that left nostril decreases sympathetic activity, where right nostril increases sympathetic activity. So if you are feeling low and if you are not feeling well and depressed, you should increase little bit challenge your sympathetic nervous system so you can feel better. So in this way, the things has been explained in many literatures. So yoga is capable of controlling and modulating autonomic function. Agreed. Overall effect is restore autonomic balance. This is what our literature says. And the response which is being mentioned is there is a decrease in resting heart rate, blood pressure, less load on heart, and more reserve is there. Head below the heart posture, it belows the baroreflex regulation. We have a beat to beat monitor blood pressure instrument. I'm going to show in the graph, and it is very much well proven that baroreflex regulation improves tremendously people who do this kind of yogic exercises. Exercise induced stress level is also severe. Better efficiency and exercise tolerance. It improves your cardiorespiratory functions, and this is what we are after here in COVID situation, to increase our cardiorespiratory system. To quantify all this, what are the techniques? There's are many techniques. I'm going to say very few. The first, most acceptable technique and most easy one is your heart rate variability. What is heart rate variability? Coming to very simple thing, we have a sinus arrhythmia. We all know what is sinus arrhythmia: inspiration tachycardia, expiration bradycardia, which is occurs in a physiological range, and this range is somewhat showing your physiological range. With a heart rate, if a heart rate is 83, somewhere your RR interval is 726 milliseconds. If your heart rate is 76, it is there. So if you see that as your heart rate is decreased, your RR interval is increased. What does it show? It shows that there is a there is a hand to hand, sympathovagal balance goes side by side. And as your heart rate increases, this beat to beat variation in the heart rate in a normal resting condition is known as heart rate variability. This heart rate variability is divided into two main components for quantification: time domain and frequency domain. Time domain parameters is generally representative of your parasympathetic activity, and frequency domain parameter is generally for your sympathetic activity. HRV is the measure of the beat to beat changes in the heart rate. The analysis of serve as dynamic window into autonomic functions and balances. So with a brief introduction of this HRV, the next we come is your inherent variability of your blood pressure and heart rate. As our heart rate is variable, beat to beat there is a blood pressure is variable. As we know that stroke volume changes with all beat. It is not that it is going to be 70 ml per beat. No, it's not. It is sometimes 59, it may be sometimes 85. It depends upon the venous return, it depends upon the preload and many other factors. So we have blood pressure variability also. And this by we calculate blood pressure baroreflex sensitivity by measuring this blood pressure variability and heart rate. For every heart rate change, how much your blood pressure changes, and this will give you our quantification of the response. Do yoga actually leads to stabilization of this variability? Is fluctuation is reducing? What does it do? The best example, madam has also in our previous talk, madam has mentioned one orthostatic intolerance component, which I'm going to show you here. What is basically that? We ask a person to change the posture from lying to standing. And when the person changes the posture, within 3 minutes of the standing, due to effect of gravity, there is a pull of the blood pressure. This happens over here. And within a span of 5 to 8 seconds, your baroreflex, if it is very active, going to take it back. And little bit increase from the baseline, gradually the response comes normally. This is the way systolic falls and your diastolic falls and your heart rate increases. This is what happens in normal physiology. But if this fall is more than 20 mm of Hg, it is known as orthostatic hypotension. Yeah, studies are going on where we are seeing the effect of orthostatic hypotension, because my thesis topic, when Dr. Dakshini was there in AIMS, I was working on this field only, that we have assessed the brain blood flow, that is cerebral blood flow, response to each blood pressure fluctuation. And actually we are working on this. Does yoga affect this? And yes, now I can say yes, it does, because we have not data to prove it. So this is a small part of our study which I'm sharing with you. What is right now that the research is going on through institutional grant. It is the differential modulation of cardiac autonomic tone during different yogic exercise. In this, we have a set protocol of 5 yogic exercise, and we measure heart rate variability as well as baroreflex sensitivity immediately after the yogic exercises. So this study is aimed to explore the intricate mind-body mechanism with a special reference to immediate effect of Padhastasana, that is forward bending, and Ardha Chakrasana, that is backward bending on cardiac autonomic nervous system, and quantify the cardiovascular autonomic response to different yogic asanas. This is just, I'm taking two asanas, and we are doing like for Sarvangasana, different Trikonasana, but this is just for this presentation. I'm sharing a small data. Here, the protocol one, the duration, like we ask a subject to take a complete rest for 15 minutes. We record their baseline heart rate variability and blood pressure responses. Then ask the subject to do the Padhastasana, that is forward bending. After 3 minutes, first of all, these are the people who have doing yoga regularly. It's not that they are coming here for first time, they are taking anybody. No, the protocol is very fixed. We have a fixed inclusion criteria, fixed exclusion criteria, and the people just only the between the age of 23 to 28 is being included in the study. And they have an idea how to do this asana. We take our HRV and pulse wave form by lead to ECG for 5 minutes. Then we do second protocol, that is backward bending, and there is a rest between 15 minutes. Now let me share a beautiful results with you. This is an HRV analysis. As I told you, this is SDNN, RMSSD, SD1, SD2 is your time domain parameter. And this is LF and HF is a most important thing. This is sympatho, this is vagal. This is sympatho-vagal balance ratio. This is sympathetic and this is parasympathetic. LF is basically sympathetic, HF is basically parasympathetic modulator. This is a baseline recording. And this is after Padhastasana. If we see that in baseline recording, Padhastasana means forward bending. If you just with me, your LF-HF ratio is decreased after Padhastasana. Means there should be an increase in sympathetic or there is a decreased in parasympathetic component, but which is not very significant, but it is there. I want to put your attention towards it. I'm coming in next of my slides or in the slides itself. And if you see SDNN, there is a dramatically increase in parasympathetic reactivity. And all the parasympathetic reactivity, if you see, it is increased, significantly increased from your baseline. Means definitely forward bending is increases your parasympathetic response as comparison to your sympathetic. And that is why your Padhastasana, your LF is same, not much increased, but your HF is increased, so ratio is decreased. We are explaining here. So there is increase in the vagal band. But what happened here is little different. When you do backward bending, that is after Ardha Chakrasana, the subject is 30, there is increase in LF-HF ratio. Now we were in confusion that in one asana, just after 3 minutes, we have such a decrease, significant, not a significant, but near to significant. And here there is an increase. How we are going to increase? Then when we look into the data, what we realize that increase in the parasympathetic parameters was drastically much more in Ardha Chakrasana, as well as there is increase in the sympathetic tone also. So overall stimulation of your, you send from cervical to your sacral component, where all your autonomic nervous system channel goes up, then it leads to stimulation of all things. So now we can prove it. We can show that yes, it is through yogasana we have better sympathovagal response. So HRV is a good specific positive predictive value for quantifying autonomic response of Padhastasana and Ardha Chakrasana. And in fact, now we can say in French, backward bending is superior than forward bending, and it should be included for stress management. The people who have anxiety attacks, the people who are having a little bit tachycardia syndrome or postural change tachycardia syndrome, that is POTS, they should at least do Ardha Chakrasana, that is backward bending, for a longer duration of time. In fact, the people having a blood pressure can also go for it, but the people having a blood pressure, that is hypertension, should not go for forward bending. We are in the verge of publishing this data. This is just a small part of it. So this is now, I can say, being physiologist, I am now able to prove, quantify my response. Yes, yoga does changes in your cardiovascular system. With this, I'm coming to my next uh, article, which is actually, I'm too much fascinated about it, is Andrew Newberg. With Dalai Lama, sir, the measurement of regional cerebral blood flow during complex cognitive tasks of meditation. This is a very renowned paper present in the PubMed, and this research has really one of our landmark in its the history. The research say in a very few slides that this is a SPECT images. This is prefrontal cortex. If you see that this is the blood supply and this is the blood supply. This is baseline blood supply and this is after meditation. There is a tremendous increase in the blood supply of the prefrontal cortex after meditation. One thing. Second, inspect if we see that parietal lobes, there is a little bit decrease here, blood supply, which is the area related to your limbic system. And when the scan of the limbic system is being done, it is being said that limbic system leads, the prayer basically leads to calming effect on the limbic system. Firing is reduced. And if anybody is interested, please go through the paper. It explains things very beautifully. Though the inference they said is that increase in cerebral blood flow in frontal lobe and shutdown of cerebral blood flow in parietal lobe is a key finding. This is a right side, and this is not a hallucination. Absolutely, because it leads to your calmness, and all meditators have same findings. This is another response. Apart from it, meditation also increases your skin resistance. And when we does via galvanic skin response, it shows meditator recovers better from stress much more quickly than non-meditators by using galvanic skin response we used to do. It decreases limbic arousal. We feel less anger level of our threshold is increased. We feel less stress and our shootout for our anger is decreased. Reduction in limbic arousal may explain how meditation strengthens and enhances the ability to cope up with stress, scientifically proven. Neurochemical changes during meditation, which is basically responsible for this kind of effect, is if you see your vasopressin is increased. This is the nucleus. I just don't want to read. I just want to see your cortisol, which is one of the, you can say, double-edged sword. It is balanced and it is decreased. Norepinephrine, which is basically responsible for sympathetic nervous system, is decreased. So we can prove, it is, studies has proved that beta endorphin, it is tremendously increased, so you feel happy. So we should be knowing what is our happy hormone. Dopamine, serotonin, oxytocin, endorphin, all increased by doing yoga. This is all about autonomic responses to cardiovascular system and a little bit of brain aspect. Now coming to respiration. Respiration is a unique system. Respiratory system is automatic, can be greatly modified and voluntarily. As we can change the respiratory rate, as madam has said, that if you're able to monitor your respiration, you can actually change your flow of thoughts. This is absolutely correct. It is being practiced and it is being shows that if you do a what you said, mindful breathing, it is very good for your concentration. This is what is there. This is your blood pressure response. This is your heart rate response. And this blood pressure response and this grid lines are with respiration. So I want to show that with your inspiration and expiration, your blood pressure is also fluctuating if you do controlled breathing. So when you expire, your blood pressure is decreased. When you inspire, your blood pressure is increased. So this is a very beautiful recording. And when you see, you really enjoy seeing it. So what does pranayama do? Rapid, deep bellows type, like Prasrika pranayamas, which increases your sympathetic. It speeds your circulation, increase blood pressure and heart rate. So the people having angina, hypertension should not be doing this. Slow, deep, rhythmic breathing, Nadi Shuddhi pranayama, it calms your mind, decreases blood pressure, heart rate, increases strength, respiration muscles, and efficient ventilation. If you see the values which we have measured, I'm just showing that normally we have, if you see, tidal volume is 500. If you do shallow breathing, it will go for around 200, but if you do go for a deep breathing, it will be up to 1000 ml per minute. Rate 12. Normally we do shallow, we do 30, and deep we do 6. That is, it is controlled 5 seconds inspiration, 5 seconds expiration, which is known as deep breathing test. Also one of the tests in autonomic function testing for assessing parasympathetic activities. Ventilation, it's same, doesn't change. Dead space doesn't change. But if you see the alveolar ventilation, it is increased when you do deep breathing. That is why it is being said during COVID, people should try for deep breathing so that they can increase their alveolar ventilation. Benefits of pranayama, as we have seen, vital capacity increases, resting respiratory oxygen consumption is this. Economical, madam has already discussed, so I don't want to repeat the same thing. So these are the benefits of pranayama. Overall effect of the yoga is it improves physiological and physical fitness. Mind is calm, tranquil, and one-pointed. It improved mood, sleep, sense of well-being, improved memory, intellect, and problem-solving ability. It is really very good for the kids doing yoga. And it improves not only their concentration, but their ability to face the problem. That is what calmness is being increased, flowering of creative abilities. People, calm mind is the wonderful creator. And the changes are consistent, and now I can say, because I have done it and I'm doing it, it is measurable. With this, the yoga strengthens, soothes, relaxes body and mind. It promotes healing. It decreases muscle tension, conserves energy, improve immunity. Relaxation is opposite to stress. It moderate hypothalamo-hypophyseal adrenal axis. One of the axes also responsible for affecting autonomic nervous system. Restore autonomic balance. Psycho-neuro-immuno-endocrinological health, stress, illness. With this, I just want to compare physical exercise with yoga, because we have to now understand why it is important. It is a holistic. Physical exercise is a competitive phenomena. It is a non-competitive phenomena. Awareness is only outer. Here the awareness is inner. Muscle activity, not in harmony ever in physical exercise. In yoga, it is harmony. It is muscles are in harmony. It is rapid, forceful movement just to increase the bulk. It is a slow, dynamic, steady, stretched response. It is a high impact. This is a low impact. It is a high muscle tension and energy consumption. It is low. Risk of injury. Here it is low risk of injury. Breathe text. It is controlled breathing is being there by yogic exercise. Sympathetic dominant. It is parasympathetic dominant, which is my end of the talk, I want to say. So with this, yoga requires you to make an effort to unify your body and mind. You do this by concentrating your awareness on your physical body through breathing and postures. To sum up, yoga is neither ritual nor gymnastic. It is a disciplined way of life. As I've already said, yoga is a discipline. Now, it is not any more fancy word. It is somewhat need of present situation. Integral development of threefold of health: body, mind, spirit, social health, science with soul, philosophy, and background. It is a conscious evolution we have to work upon, and it is a rishi culture of past, faith of future. With this, my favorite quote with Swami Vivekananda: wait and meditate till I call you back. Thank you very much. I'm now open for a question.
Thank you, ma'am.
Thank you,
Many,
sir.
many thanks for your illustrious and explanatory lecture. Your findings are too much useful to us, those who are teaching physiology and physical education like this, and
Thank you,
also
sir.
helpful to the professional workers. But
Yes, sir.
with your kind permission, I have a question.
Sure, sir, please.
Uh, are our respectable doctors follow it without prescribing a full-page medicine?
Yes,
Your findings are very much useful to us. I think if we practice yoga,
yes,
uh,
sir.
your findings will be helpful to us to understand and to teach physiology, uh, uh, to say something with your findings.
Yes, sir.
But it's my expectation that our doctors should follow it.
Yes, sir. Sir, actually, now what you have said is to be done now, sir. It has to be because now in AIMS also, like in Delhi AIMS, we don't have Ayush block earlier, sir. In newer AIMS, we have now Ayush block, and now we are including yoga faculty, different yoga faculty, and every patient who is having hypertension, diabetes. Now we are making a protocol like for diabetic group of patient. This kind of exercise is there. So this research is being done to introduce
Oh,
that kind of lifestyle in the patients, sir. We are
okay,
trying to
okay.
do, sir. And I'm
Many
sure it is going to benefit the society, sir.
okay, okay. Now, probably we have a question, Dr. Mohapatra, please.
Yes, sir.
Yes, sir. Thank you, sir. Ma'am, we have a question.
Yes, ma'am.
Is there any kind of yogic practice which
Mhm.
can be used to modulate electrical impulses or disorders in heart from SA nodes or AV nodes, which can be probably used uh, as a
Mhm.
replacement for pacemakers?
Dr. Dakshini, if I understood, the person wants that the people who required pacemakers, right? Their SA node is not firing well. This is a ischemic response, madam. That happens when there is a permanent damage. Yogic exercises, right? What it do the sympathovagal balance. In somewhat, if there is if you do a continuous pranayama, slow breathing exercise, definitely there is an increase in your stability of your heart rate, right? Ectopic
Yes,
is
ma'am.
reduced. It is being there in the literature that when you do yogic presses, your ectopic is being reduced. But madam, when pacemaker is required, means there is a permanent damage to the SNO. So I already said that prevention is better than cure. If any person is having labile hypertension or any kind of angina, the person should start doing pranayama as early as possible. Then the person can be prevented to go to the pacemaker. Even with the people with the pacemaker who have another point I have to make, the people with the pacemaker, right, who are actually not responding well, will respond definitely well with yogic pranayama if their pacemaker is not responding well. But I cannot say that increase in electrical activity. Only I can say that it increases in pathovagal and definitely pathovagal balance. If it is happening, it is somewhere autonomic response is there.
Thank you, ma'am. Thank you.
Any other question, madam?
No, ma'am, there are no more questions.
Thank you so much, Dr. Dakshini, and your team for giving me this opportunity. It was wonderful to interacting with you. Thank you, madam.
Thank you, ma'am. Thank you.
Good afternoon, everybody. Thank you, Dr. Mashanto. Thank you, the organizer of Government Degree General College, Mohanpur, Paschim Midnapur, West Bengal. Myself, Dr. Krishnendu Pradhan. I would like to request our next speaker, Dr. Kuntol Ghosh, uh, to say something about his experience in the professional field of yoga. And I would like to request Dr. Ghosh to introduce us, all the audience. Dr. Ghosh is presently Associate Professor in the Department of Yoga in Manipur University, Imphal. He had completed his post-graduation and doctoral degree in yoga from Swami Vivekananda Yoga Anusandhan Sanstha, Yoga University, Bangalore. He has over 5 years of experience in teaching at various institutions and has several published articles in national and international journals in the field of yoga and sports sciences. His expertise is in traditional yoga practice and yoga therapy. Now I would like to request Dr. Ghosh to deliver his lecture on uh, today's topic on meditation and its neurophysiological effects. effects. Over to Dr. Ghosh.
Am I audible?
Hello.
No, sir.
Yes, sir, you are
No,
audible.
sir.
You are
No,
not
sir.
clearly
But
audible. You are
yes,
now here audible.
I'm audible. All.
I think Dr. Ghosh has some network issues. He will be rejoining.
Okay. Technical defect is there.
Yes, sir. Dr. Ghosh, Dr. Ghosh, please unmute yourself. Sir, you are visible now, but you are not audible. Sir, please unmute yourself. Sir, you are visible but not audible.
Now you?
Yes, sir. Now you are audible.
Yes, thanks. Sorry, this. Okay, so I'll not delay too much. Let's good evening to all, and I would like to offer my sincere thanks to Government General Degree College Organizing Committee, and also my special thanks to Dr. Devaprasad Salser, by whom I have been introduced in this webinar. So I just saw these speakers and I just listened at last Dr. Madam's uh, lecture. So very frankly, I should supposed to say that it is really good that I did not make any presentation, because if I made that presentation, it would be repeated all these things. Because when we're just looking at mechanism of yoga, it is more or less same platform. So this Dr. Madam, what she done actually, she reduced by all that work. What I should supposed to tell, that I hope that already she explained very nicely, and probably this might maybe 20 to 21, 25 minutes talk. It will be a bit of repetition on that. So dear audience, please just beware of that. And then I'll just start as I just got the time. Basically, this 20 minutes you'll be get exposed about that concept of meditation. Let's take a concept of meditation and its neurophysiological effect. So that first half, I would like to talk that about that meditation. So what way I can just start? Meditation, we all know that meditation means basically in Sanskrit it is dhyan. Sanskrit it is dhyan, but please keep your mind, meditation is not exact meaning of dhyan. This meditation, if you look it, this word is derivated from the Greek word meditative, medication. It is basically medication. So means which things is that which basically help as a medicine. Because when that Western people actually came to India and they saw this, that our Indians all sages, all that yogic practice, with that beard set, they are sitting in under the tree and they are doing something with closed eyes, and they could not able to think what they are doing. By doing that, they could able to free from all that problem. Even they don't have any disease for them, they are so happy. Then probably they have given the name, okay, this is the something, it is for disease free or healing something. That's why they have given the name meditation, or what we call in Sanskrit it is dhyan. And as a yoga aspirant, actually meditation dhyan is one of the seventh limb of Ashtanga Yoga. Ashtanga Yoga is basically given by Rishi Patanjali, and dhyan or meditation is the seventh limb of Ashtanga Yoga. And he has given very scientific steps for growth for that higher dimension in the spiritual journey. And it starts with that yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi. So basically, dharana, dhyan, and samadhi are considered as the antaranga yoga. This antaranga yoga is nothing but directly to control our mind, directly control our mind. That is basically antaranga yoga. And Patanjali has given the steps. It is for higher spiritual journey. And what today we are just talking about in this pandemic situation, we are just taking the yoga as a medicine. It is the outproduct of that. It is the outproduct of that. It has that higher dimension. Anyhow, this dhyan or meditation, when you just talk about it, we just look at the Bhagavad Gita. In the Bhagavad Gita, chapter 6, entire chapter has been dedicated for dhyan only. And there that Krishna Bhagavan elaborately explained what is the dhyan and what is the benefit of that, how to practice this dhyan. all this thing. And if you just look at then in chapter 6, when that Arjuna, all we are the part of Arjuna exact. If you just believe that all we are the part of Arjuna, as a representative of us, Arjuna asks that question to Krishna Bhagavan, oh God, please tell me. He just asked that this Chanchalam hi mana Krishna Pramati Balavadhuram Tasyaham Nigraham Mani Vayu Rivasuduskaram. He says that Chanchalam hi mana Krishna. His mind is so chanchala, so restless, so fickle, so stubborn. And according to me, I consider it is so hard to control as hard to control the air. Like that's what it was. Our mind is just chanchala mind, fickle mind, very restless mind. Oh Krishna, how we can control that mind? And then Krishna replies like that. Asamsayam Mahabaho. No doubt, Manadurnigram Chalam. It is no doubt this controlling the mind is so tough, but you can do it. How we can do it? Then he has given the two things for us. Abhyasena takonteya, vairagyena cha grihati. O son of Kunti, by the practice, regular practice, that is the most important. All we know that yoga works, all this thing, it is just thing is that regular practice. And as the previous madam actually talked about that regular practice is really, really required to get that benefit. So, abhyasena takonteya, vairagyena cha grihati. And then he has given that another more thing. Vairagya is nothing but how to detach, not react, being with this worldly object. That is the most important. And for that, this Patanjali has given that series of practice. Beginning, he started with that yama and niyama, code and conduct, don'ts and do's. And then Patanjali asks, please to practice as a third limb asana. Through your physical body, you could able to control your mind. Then he has given the technique of pranayam, and he has given the deeper things. Next, he talked about that pratyahara, and then come dharana and dhyan, and then further more things. So let's come back to again that meditation. So if you really want to understand what is meditation, so meditation is basically nothing else. It's a yogi concept. We always say that it is stilling of your mind. It is a novel stilling process. What is mind? What is mind in the modern physiology? People always say that mind is basically brain activity, but as a yoga aspirant, as a yoga teacher, as a yoga background, we always say the mind is nothing but a just conglomeration of thought, collective thoughts. And what we do in meditation, consciously we eliminate the loop of thoughts. Consciously we eliminate the loop of thoughts, our internal dialogue. That is the process of meditation. So what is the meditation? Meditation very conscious. Hello, shall I continue? Yes, sorry. Yes.
Yes. You are audible. Please
Yes. Sorry. This is that's why whenever Whenever we just start, we decide that Om Shanti, Shanti, Shanti to obstacle that Ashanti. So this, though this is a really good platform, but sometimes due to the connection, or we just discontinue. Anyhow, let's come back. So I was just talking about that meditation, that mind, and mind is nothing but just a collective thoughts. And what we do in meditation, we basically eliminate the thought process. So how we do this thing? For that, it would be better to understand the various facets of mind. When we understand the various facets of mind, then we can easily understand what we do in basically during the practice of meditation. So various facets, when I just talk about, we should supposed to understand this. We have the various stages of mind. In a sense, first stage we call the chanchalata mind. That as Arjuna asked the Chanchalam Himana Krishna, the Chanchalata mind, restless mind, it is just like a baby mind, as just baby's mind. It's jumping here and there. I always give example. This Chanchalata mind is nothing but monkey mind. Monkey always jumps here and there. So how you can just say that what is Chanchalata mind? In the Chanchalata mind, there is no connectedness, haphazardness, disturbed mind. It is multiple thoughts, multiple objects. Just now I am just talking here, my mind will jump to my breakfast. Again, it will go to somewhere else. So there is no connectedness. This is called chanchalata mind. And from there, what we do, we give them some sort of support or alamba. In that meditation, we slowly we shift it from chanchalata to ekagrata mind. Now, all we can easily connect it when we're just starting. Also, if our mind is so chanchal, then you can see that we are just studying for an hour, so we could not able to grasp it, even we could not able to buy it. What happened? Though we are studying, but our mind is jumping here and there. It is difficult to just study it. It happens sometimes. But when we just sit from chanchalata to ekagrata, then you see that things is happening. What is ekagrata? Ekagrata is nothing but single object. Object is single, but thoughts are related to that object. It is channelized mind. Slowly mind start to channelize. Single object, multiple thoughts related to that object. In Chanchalata mind, multiple object, multiple thoughts. How you could able to control? That is a stress mind, tension mind. And in this pandemic situation, that's basically happening. And now this ekagrata mind, what's happened? You are just channelizing your mind. That is a single object, multiple thoughts. In the sense when you are starting also, I should supposed to connect that when we were studying also, what happened that thoughts is related to that subject only. Even when we are doing that meditation, we just may get that in support alamba, maybe that my guru or deity or omkara, whatever is there. So that thoughts will be related to that. Thoughts will be related to that. I just can give example in when we just sit meditation on front of that om. So when we just sit, there will be lots of thoughts, other thoughts. As we close eyes or open eyes, we look at the Om. What we do, next stage is automatically happen. Whatever thoughts actually comes in our mind, it is related to Om only. It's just eliminate the other thoughts. That is basically Vedanta detachment. And what we are trying to do, we are just concentrating one point. And there probably whatever thoughts will come, it is related to Om, all the structure of Om, maybe that curvature, top that the crescent. Sometimes you look at the color of the Om, the brightness of the Om. All the thoughts are related to that same object. That is called Ekagrata. When we reach that ekagrata, then we are very one step forward for dhyana or meditation. When that ekagrata happens, then comes to the next step. That is called dharana. And Patanjali very nicely explain what is dharana. Deshaha bandhaha chittasya dharana. Deshaha means place, object, alamba sapat. Desha bandha means fixing. Fixing your mind in a single object is called dharana. So what happened from ekagrata to dharana? Ekagrata, that is a multiple thoughts, single object. But in dharana, single object, single thought. Single object, single thought. Again, we are eliminating all others. Now we are being with that one thought, one object, that is called dharana. Now, when we reach at the stage of dharana, then we are very near to dhyan. Till now, we are not in the dhyan. When this dharana will be effortless, that's why Patanjali says that tatra, on that position, when you could able to reach in dharana, tatra pratyaya ekatanata dhyana. After achieving the dharana, when your dharana will be effortless, so effortless dwelling in a single object, it is called dhyan or meditation. So what happened in meditation? Up to this dharana, we are just bind with time, pace, causation. That's happening when you study also. But sometimes you see that when we are studying, we are so engrossed, we are so loved. We don't know when the time's actually over. We maybe sat at 8 o'clock evening. It is 10:30. Mom is calling for food. We don't know when the 2.5 hours over. Same things happen when we just jump to dharana to dhyan. We are just free from time, space, causation. It is effortless dwelling in a single object for innumerable time. Actually, there is no time plus causation. That is called meditation or dhyan. So audience, I want to show all we know that we basically say that we are practicing meditation. Today I practice 1 hour meditation, I just please what we do in general. We basically work on the later phase. We are just shifting our stages from chanchala to ekagrata, ekagrata to dharana, and sometimes maybe we are in the stage of meditation. I always give that example. Meditation is the same as sleep. All the difference is there is no awareness. Here with awareness we are shifting. In sleep we don't have any awareness. It is same. If you ask me that I am sleeping, am I sleeping? No, I am aware. If I say that I am practicing meditation, I am practicing meditation, it is at all, you are not at all practicing meditation. Same things happen in sleep also. We don't know when we sleep to sleep. We don't know when we sleep to sleep. We don't know. If I say that in that moment I sleep, no. Just what we do, we just make a good environment. In the sense, we dim the light, we make a good bed, and we just wash our face, we just soften everything, our dresses, then we just lie and we don't know when sleep to sleep. Same things happen in meditation practice also. We just make a good environment. We sit in the serene, quiet, calm atmosphere. Then we start to just ekagrata and dharana. Then we don't know when we enter to that meditation. And when we just enter to the meditation, then there is no time plus causation. And then you might have seen that sometimes it may happen actually. You are just sitting for a half an hour for meditation. You don't know it is just spending with just like a 5 minutes. So half an hour when it will be just like a 5 minutes, probably you are in the stage of meditation. Probably you are in the stage of meditation. So this is the meditation, and you can see that in this present time, innumerable techniques are available. Lots of meditation techniques, but probably all these things work in that ekagrata, dharana, and dhyana, and then further forward that meditation basically comes. And really, if you just as a yoga student, is required sometimes guru upadishta margena, by the advice of guru, because guru knows that disciple mind and he can train the disciple to just go for this higher practice. Anyhow, various type of meditation techniques are available, just like a Brahma Kumari's meditation, then Shiv Vipassana meditation, transcendental meditation, Buddhist meditation, Sahaja Yoga meditation. Even in our West Bengal, also we know that very respected this Kriya Yoga, even Ramakrishna Parampara, there's lots of meditation. But please, we are What we do, we just go step by step, step by step, step by step, and we enter that. And we enter in this meditation technique. When we enter this meditation technique, probably what we do, that is the definition of yoga. That is the definition of yoga. It is called mana prashamana upayaha. What we do, we just मन को शांत करार जे पद्धति. What we do in this meditation, we just make our mind quiet and calm. How that mind become quiet and calm, you know? Only the speed of the thoughts, speed, we could able to reduce it. How we could able to reduce the speed? By eliminating the loop of thoughts. Eliminating the loop of thoughts, because in the present scenario, you please try to understand, there is no technique. There is no technique to de-accelerate our mind. There is no technique to de-accelerate our mind. You can see that our mind is so stressed, tension is accelerating the speed. We don't know how to stop it. We don't know how to stop it, stop that mind, the thought process. Only meditation, yoga can help to de-accelerate that process. So de-accelerating the speed of thoughts of our mind is the process of meditation. Or this is the definition of yoga as a mana prashamana upayaha yoga. When that happens, then rest of the things, what basically we say, we get as the output. We say as the output, and as a Patanjali, this is the basically doorstep for samadhi, for spiritual higher journey. But in this pandemic, in this situation, what we are looking, when we'll be going through that stage, what the previous madam, Dr. Madam, basically spoke, all these things happen automatically. But please try to understand, first thing is to reduce the speed of thoughts in our mind. When speed of thoughts in our mind will reduce, what happens? We could able to reduce the brain wave frequency. We are shifting that with awareness. With awareness, we could able to shifting our brain wave frequency from beta to alpha, alpha to theta. That's the main purpose. As long as we are stressed, tension, and all these things, it is always that's the beta stage. We are so anxious, so anxious. When we just sit for meditation or whatever yoga practice we may do, our main object is shifting our brain wave frequency, that is mana prashamana, reducing the speed of mind. And when reducing the speed of mind, automatically the brain wave frequency reduces. When brainwave frequency could able to reduce, then you see that all the things changes, whatever we are talking about last previous lecture also we heard this thing. When the brainwave frequency will, this is the basically our master circuit. When these things will get rest, then you see that what happened. And it's just what happened when we practice that meditation. Very simplest word, I can just say that at the physical level, at the physical level, we get the deep rest. At the physical level, we get the deep rest when we practice that meditation. Not only that, our heart rate goes down, our mean blood pressure goes down, then systolic blood pressure, diastolic blood pressure goes down, your pulse rate goes down, your breathing rate goes down, your sweat gland activities reduce, you feel the relax. This is the way your physical level, you will see that changes. What happened in your mental level? Yes, it is basically concentrated, play of concentration, awareness, play of concentration and awareness. So that things happen. So your attention skills, sustained attention skills increase. You could able to adopt that stability, that inhibition capacity. That is the most important even in this pandemic situation. You could able to adopt that inhibition capacity. That inhibition capacity will help you not get disturbed by any situation. The situation may be outside, coming from outside, situation may arising from inside. So that will not get disturbed, and that's why you will be get the stress free. Even That inhibition capacity will improve when you're practicing this yoga practice. Not only meditation, you can take anything, but meditation is basically helpful directly to control your mind. So that's the thing. Even in that emotional level, you'll be emotional stable. Same things. Emotional stable. What is emotional stable? Whatever good, bad, whatever situation may come, you could able to quiet, calm pace. And it is too required in this pandemic situation. We are not going to change anything else, but unnecessarily we take the stress, tension, and we just increase the speed of thought. क्या होगा, क्या होगा, क्या होगा? कब vaccine आएगा, कब vaccine आएगा? How I will just have it. All these things. The speed of we are keep on. We are thinking. Please look at the day. How many times we just talk about, but there is no work for us actually. But this it is required. It is not react on that. You do your work, but it is not. It should not disturb us. That's why this meditation and all other things is required in this thing. As Bhagavad Gita says that, this is very simple things. As Bhagavad Gita says that we are our friends, even we are our enemy also. We are our friend. Atmaiva ipu atmana bandhu atmaiva ripu ratmanaha. We are our friends. Again, we are our enemies. When we'll react in this outside, whatever situation is happening as a stress, tension, then all our this systems, nine system will work as the enemy. Our respiratory system will go havoc. Our immune system will get disturbed. Our circulatory system goes out of control, they will be just our enemy. But we can control them. We can control them. That is the trick of yoga. And that is the need for our, that's why this yogic practice, all are emphasizing more in this pandemic situation to practice and make yourself stable and be happy being with this worldly object, worldly life, whatever situation may come in. Actually, we cannot change all the situation, but we can change ourselves. That is the things, and that can be done by the practice of yoga or meditation, whatever you can say. As my topic, meditation, I will just emphasize that things. So, with these things, basic understanding of the meditation, let's go back to the next stage. What's happened? And that's when I talk about what's happened, it is so easy for me, already discussed by the previous speaker. Its concept is more or less same. But please, I always emphasize the concept comes from that mana prashamana upaya. When mind is quite calm, we could able to reduce the speed of mind. We could able to subtract the brainwave frequency from beta to alpha, alpha to low level of theta. Then you see that's all changes happen. And these changes happen probably it is basically, I always give the changes happen. The three ways we can say that. One is the first things I can easily see that what I want to discuss. This is reticular activating system. Reticular activating system is a basically very huge system. All you people are physiology people, you know more than me. This reticular activity system, there is a four basically main reticular activity system, which is non-epinephrinergic pathway. This is a huge system pathway where this non-epinephrine, then serotonergic, then dopaminergic, and then cholinergic as acetylcholine. These are the basically pathway. If you just look at basically meditation works or yoga works on that level, and that's what basically neurotransmitters. And this neurotransmitters is nothing but the vitamins for the brain actually. When this neurotransmitter gives the good vitamins, it makes the brain healthy, and you see that changes happen. So it is basically reticular activity system gets chance when you do that meditation, and reticular activity, as I just mentioned, that non-epinephrinergic pathway. It is a basically vast distributed pathway. It start from the basically locus cellulus of the spons, and then it projected more or less all parts of the brain. starting for the frontal cortex, then limbic system, again cerebrum, even it goes down also. Same way, if you just look at serotonergic, also probably serotonergic is coming from that brainstem of this raphe. Again, it is again its cortex, limbic system, all other parts. Its axon are projecting all areas of this. Axon are projecting all areas this thing. Even dopaminergic also more or less same is basically coming from the substantia nigra of this midbrain, and again it's projecting also this more or less this cortex, even other part, and same things for that cholinergic also. So if you look at this, all these acts and all this part is connected with that main areas, main areas in the starting from your amygdala, then hippocampus, then hypothalamus, thalamus, basal ganglia, then prefrontal cortex, and these are the areas basically responsible for higher dimension. It is the learning, it's the memory, concentration, your mood, your behavior. All this is basically controlled from here only, and you are changing your software here, automatically you could able to get that benefits as a output. That is the main part actually. And as we people, you people know more than me, this limbic system is the basic set of emotion. Whenever we just stressed up, it's just stays the limbic system send that information to hypothalamus, hypothalamus to pituitary, and then adrenaline. All you people know more than me as a physiologist that pathway also it works a lot when these things happen. It is vice versa. It is a vice versa. When this thing happen automatically, other things happen automatically. Not only that, other pathway also when this, and this is the basically pathway to the stress what the previous speaker already elaborately basically talked about this stress response, all these things. Other also the same things happen when this autonomic nervous system balance, in the sense you're just vagal tone, the vagal parasympathetic activity increase, and vagal nerves is the one of the things is take care not only our heart, our respiratory system, even it's basically control our digestion also. That's why you might have seen that whenever we get stress, tension, and things, first it's affect as a acidity. Acidity, you start to just little bit disturb your acidity digestion problem. This is the first part of the stress tension. This is simple trick. When you start to meditation or yoga practice, you could able to reduce your sympathetic activity, automatically start to changes. So it is the vice versa. I will not go too much because previous speakers already elaborately talked about all this meditation technique. I will just give that some few studies, whatever I have gone through this, and lots of studies you will get it by the practice of the meditation. So first I will just talk about uh, this some evidence-based studies. Let's talk about that brain wave frequency. So it has been found that when a practitioner practicing meditation for a long time, for a long practitioner, they could able to reduce the brain wave frequency from alpha, beta to alpha, even low level of theta. That is during the meditation practice. Not only that, when they come out from that meditation, even they could able to maintain the same stage as a semi-meditation stage. Semi-meditation stage, they will be the same way the low level of alpha or theta. That's why you could able to see that's our meditator practice or Swamiji, whatever they were so quiet, calm for everything. Why? What is the clue for that? They could able to reduce that this high frequency, or they always be in that low, relaxed mode. That is the first part. Even research have found that this frontolateral, this left frontal part actually, that is a activation of low frequency of alpha, beta, and also right. This is the basic things. Not only that, but there is a lots of other studies also. It has shown that what I should supposed to talk about, because previous speaker already spoke about other things. Yes, I will just talk about a little bit that plasticity part. When we practice that meditation, even we could able to change that our brain thickness. So one of the studies, it is Buddhist studies, just like a Dalai Lama, this Buddhist study, it was just compared with the long-term meditator with the short-term meditator. Long-term meditator with short-term meditator. Long-term in the sense whose age is above 45 and they are having more than 15 to 20 years practice of Buddhist meditation. And they were compared with the Novik meditator whose age is 18 to 20. And when the hippocampus areas was just checked, the thickness of the hippocampus, it was same as that long term meditation in the sense for whose age having 40 or 45, same as 20 years. So what it shows the result, they could able to delay the thickness, they could able to delay the reducing the thickness of hippocampus. And we know that what is the importance of the hippocampus and amygdala area. That's why they are so happy that personality trained, you can see the changes. This is the basically plasticity changes happen when we practicing this meditation. Not only that, even when you look at the other practice, basically what we do in generally in during meditation, there is a play of concentration, awareness, sustained attention. And the sustained attention we're looking at is basically responsible for prefrontal cortex, cingulata, and other parts. And when the practitioner practice and meditation, that part is basically more active. The spirit study shows like this. So we'll get series of this type of studies, is evidence-based studies, but the yoga basically work in the neurological level and the peripheral changes happen, what the previous speakers basically talked about. And I will just try to finish up because this is a basic concept. Even when we practice that meditation, what type of meditation we are practice depends upon that way also your brain wave, that activity of the brain also change. There is a various type of technique. If simply we just observe the breathing, that is also one type of meditation technique. Sometimes we're reciting mantras, that is also one type of meditation technique. Sometimes we are concentrating, that's also another type of meditation technique. So it depends upon that what type of meditation we are doing. According to that, that particular area of the brain gets activated. If we practice some meditation, it is related to that breathing awareness. Basically, this Goenkaji's meditation, what we call Vipassana meditation. It is very simple technique. It's that they will ask you to sit and simply observe your breathing. And you will see that your terrorist mind, they will not ask you anything else. They will ask you to just simply sit and you just observe your breathing. Observe your breathing. When you start to observe your breathing, you could able to see that your terrorist mind, your mind will be tortured. Anything else, I have heard from this experienced people who are acting in that meditation, Vipassana meditation. They told that at the third day, it was so horrible, they could able to just open up. That much disturbed they get. But as the days goes, actually 6 7 days, they become so quiet, calm. Same alamba, same breathing technique helps to quieten their mind. They could able to peace. So this type of breathing techniques, if you just look at, show we know that it is basically activate that prelimbic region of insula and anterior cingulata, where that meditation techniques basically more emphasis on the breathing. It's basically activated the prelimbic region of insula or anterior cingulata region. If meditation is related to emotion, so definitely we know that which area of our brain is basically related to emotion. It activates the limbic region, limbic region. If its meditation is related with mantras, chantings, or others, it basically activates that frontal parietal, basically frontal parietal network of internalized attention. That area, basically attention area, will get activated. So that's the things of this meditation. And I will just finish up with the short story. I'll just take that example that what happened when we just practice that meditation. As the previous speaker told that this basically we allow that reduce the stress response, right? That cortisol level reduce. When cortisol level basically reduce, the baroreceptor, pressure receptor give that information to heart, and again that parasympathetic activity of vagal tone increase, blood pressure goes down, all the changes happen, you know, all the changes happen and your blood pressure reduce, all this thing. I will just take that one example. I have worked as a senior yoga therapist in my previous workplace, Swami Vivekananda Yoga Anusandhan Samasthan. There is one health home where we just did all type of diseases starting from hypertension, diabetes, arthritis, all. At that time, I was a senior yoga therapist. One event actually happened. I should supposed to say what can make that meditation and all other things, how it basically helps. And then I will just stop this thing. One participant, we call participant, we don't say that patient. So one participant came in our health home as a hypertension, and when he landed there, basically his blood pressure was quite high. In the systolic, that upper it was 190, and the diastolic it was 110 something. And then he basically admitted in that hypertension section, where we basically taught him that yoga module for hypertension. That is different things. But what I want to share you, every day basically we have the 9 to 10 that parameter time, you know. In that parameter time, participant they get chance to talk with that doctor and therapist also, and we generally measure the basic parameter, their blood pressure and all other things. So in the third day of his therapy, suddenly that one of our therapists, not I am, one of the therapists are hypertension. He just measured his blood pressure and he saw that his blood pressure drastically goes down. Previous day it was, previous day it was just as I told you 190 by 110. And that day actually it came down 190 to 140 and this 110 to 90. And the therapist were not so efficient about measuring this blood pressure. No? So the therapist, he had some doubt that, oh, I might say measure kiya to. As he just he had the doubts. Then what he did actually, he just took that patient to his sectional doctor actually, and the doctor again measured. And doctor also got same type of reading. Doctor also got same type of reading, 140 by 90. And doctor also had doubt. What happened? Yesterday it was 190, just 3 days. Suddenly it's reduced that much. Then they thought, let's talk with our chief yoga consultant, actually, Dr. Nagaratna Farsipi. And Dr. Nagaratna, she's having that vast experience. So she basically sat in front of that participant and asked that participant, can you please tell me anything's happened to you just today or yesterday evening when you are practicing? Then he explained that clue, you know. Then he explained that clue. Madam, you know, today morning, basically in our session that morning 5 to 5:30, we have Om meditation. 5 to 5:30, half an hour. So he was telling that, Madam, you know, when I was just attending that Om meditation, today that who was giving that instruction, it was so nice. I was just practicing Om meditation. I don't know when that Om meditation session over. When I opened my eyes, I saw that all the participants they had gone their respective section. I was alone sitting in front of the picture of Om. Then Nagaratna madam just smiled and asked, "You might have slept because that he had that early morning." Then he told, "No, madam, please, I did not sleep at all. That instruction was so nicely. I was just reciting Om, reciting Om, reciting Om. I was so aware that, and then I don't know when the time was when that instruction over. All people actually. As I told you, this is the meditation. When I say that I am doing meditation, I am doing meditation. We are not doing meditation. Same things happened to that participant. He was so absorbed with this instruction. He was reciting that Om. He was just absorbing the picture of Om. With this process, with the Chanchalatu Ekagratu Dharana, he somehow sleep to that meditation stage. Probably he may attain that part of partially samadhi, something I don't know. but he entered that stage of meditation. He was not bound by time, pace, causation. He don't know when the time over. That things happened to himself, and that made the changes when this chapter through this meditation. That's why this one session is good enough to change the drastical changes. That is the power of meditation I have seen as a practical power of meditation or yoga, whatever it is. It's yoga works. And I have seen the lots of miracle cases like that being with this my previous institution as a yoga therapist. So this is the basic concept of meditation. I want to just conclude here. So my request in this pandemic situation may arrive in various ways. It may not be favorable to us, but ourselves we can just control ourselves, and that things is basically yoga or meditation, whatever asana, pranayama, meditation. That's my request to all. Please just take this message and practice yoga, meditation, and other things according to your timetable, and try to just combat this situation. Be happy, peace, and be safe. Thank you. Thank you very much.
Thank you, Dr. Ghosh, for your nice presentation of different types of meditation, how meditation responds our central nervous system, and how we control it. It's nice information to us. Dr. Ghosh, once again, I'm thankful to Dr. Ghosh. His busy schedule, he is with us. And any question, may I request Dr. Mikhail, any question? Is there any question in this session?
Yes, sir. Sir, actually,
Yes,
there is
please.
an echo. Yes, sir. Now, yes, sir.
Yes, please.
Um,
Any question?
yes, sir. There is one question. In a
Please.
state of meditation, are there any mental fluctuations or waves due to subtle samaskara?
Yes, 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 yes. Definitely all this thing influence when you just look at that meditation, your samskara also influence, even your food habit also influence, your bichara also influence, it may influence. Yes, it may influence. So that's why you might have seen that depends upon your samskara that people come. You might have heard that Ramana Maharshi. Have you heard the Ramana Maharshi, even Thakur Ramakrishna? They had by born, their samskara was so pure. Their samskara was so pure, they could able to sit and they could able to go for trance and that thinking. But it may not happen to us. Through meditation, we can purify that. Through meditation, the process, conscious process to even annihilated or purified our samskara. So samskara may influence. That's why when we just take it as a higher spiritual sadhana something, then gurus it is required, and gurus know where we are, what is our mental stage, how we should supposed to practice. That's the thing. Samskara really influence.
Thank you, sir. Thank you, Dr. Pradhan and Dr. Mashanta, for chairing the scientific session. I would now like to request Dr. Pradhan to kindly say a few words. So before you start, there is an echo in the entire system. I request Dr. Ghosh to kindly silence the... Yes, sir. Now it is okay. Thank you.
Thank you once again, Dr. Ghosh. Thank you for your presentation. This is the very information to us regarding the your meditation part and different type of meditation, how we'll control it. Okay, thank you once again. Thank you to Dr. Kuntal Ghosh. This is a 2-day international webinar on yoga, the holistic approach for physiological and psychological homeostasis. In this webinar, today's webinar, we are in the last stage, in the first day, in the second technical session. We have with us three eminent speakers. In the second session, we have first speaker was Professor Pratiti Ghosh. Very informative and very nice lecture. He has presented us the homeostasis through yoga. He started the types of yoga, what types of yoga, new dimension we have got from this information, the acro yoga, the Bikrama yoga, the aerial yoga, and after that types of yoga, he has nicely presented the effect of Surya Namaskar, how Surya Namaskar affects our body and mind, and finally the how we'll measure the different aspects of physiological and as well as psychological aspects of different system. And finally, he gone through the homeostasis part and the holistic approach of homeostasis. In this part, he has elaborately discussed the nervous system, mainly on central nervous system and autonomic nervous system, and 5 cores, how cores affects and irritate us in our brain. After that, he has presented nicely presented the EEG effects of our cardiovascular system, and 72,000 nodes how affects our body and how we'll control that in physiological point of view, mainly in idea, pingala, and susoma. These are the main three cores among of the 72,000 cores. And then finally, he gone through the cardiovascular disease, including respiratory, finally respiratory system, and in pandemic situation here, in the how we'll improve our immunity system through yoga practice. He sees elaborately nicely to us, and we will try to our level best to implement this type of practice in our daily life. And secondly, it's another very nice presentation by Dr. Ekta Khandwal. It's a nice nice presentation, and she has done it so many research work and database research. I am very gladful to convey my regards to her. And she has mainly presented the body, mind, and spirit relationship. How body, mind, and spirit we control through yoga practice in the different aspects of systolic, diastolic, as well as the our autonomic nervous system in this regard. And finally, in the last speaker, Dr. Kuntol Ghosh is the specialist in yoga, mainly on meditation. We are simply know the meditation is the concentration of mind, but one thing is that the different type of meditation, model of different modules of meditation for different people. It should be depends upon their irritation, how level of types of irritation takes place in our central nervous system. In this regard, I would like to my gratitude and thanks to all eminent speaker in this technical session. And finally, it is my pleasure to present with us in this type of webinar for to our this convener of this webinar, Dr. Prosenjit Chakraborty, and organizing secretary Dr. Dakshayani Mahapatro. I am also very much gladful my own colleagues and of the officer in charge of the and patron also of this institution, Government General Degree College, Mohanpur, West Bengal, India. Thank you very much. Thank you. Over to Dakshayani ma'am.
Thank you, sir. Thank you once again. I would like to extend our heartiest greetings and gratitude to all our respected delegates. With this, we come to the end of the first day of the 2-day international webinar. On behalf of the organizing committee, I would like to extend our heartfelt gratitude to our eminent guests, chairpersons, delegates, colleagues, and participants for the overwhelming response, interest, and cooperation they have given us. I would also like to extend heartiest greetings to all of you on behalf of the entire organizing committee on this auspicious occasion of Ratri, which is considered as in various different forms throughout India in South India as Dasara, in West Bengal as Durga Puja, and in most of India as Navratra itself. I would also like to share an announcement that the feedback form link will be given at the end of the webinar tomorrow after 6 p.m. and the participants are kindly requested to submit duly filled forms so that they may receive the certificates shortly. With this, I would also like to announce that we shall be resuming the third scientific session tomorrow, sharp at 10 a.m. Now I request Proshenjit sir to close the session for the day with the Shanti Mantra. Proshenjit sir, we cannot hear you.
Okay. Sorry. Survey. Am I audible?
Yes.
Survey. Kuntal, please kindly mute.
Yes, I am just mute on the phone.
Doctor Ghosh, please kindly. Thank you. सर्वे भवन्तु सुखिनः सर्वे सन्तो निरामयाम् सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्तिः नमस्कार to all.